Hi, my name is Christine Walsh, and I am presenting my validation for nasogastric tube irrigation. The first thing I'm going to do is make sure that I have the order from the doctor, which I have. I am then going to make sure that I have the correct patient and validate their identity by looking at their wristband. Okay. The next thing I am going to do is introduce myself to the patient. Hi, Mrs. Jones. My name is Christine Walsh. I'm going to be your nurse today. If you have any questions during the procedure, please just let me know, or any pain. I'm going to be irrigating your nasogastric tube. If you have any questions, just let me know. The next thing I'm going to do is provide for patient privacy and pull the curtain around. I am then going to gather up all of my equipment, my syringe, my stethoscope, my padding, my extra water. I am then going to go wash my hands. I am then going to put my gloves on. Excuse me. Okay. Okay, I have my gloves on. I am now going to move my patient to a working level. My patient's at a working level. I am now going to move them to 30 degrees, their head to 30 degrees. I'm now going to move the bed rail down so that I have better access to the patient. Alright. I'm going to assess the nose area to make sure that the tube is intact. It hasn't been tampered with, pulled in or out. I'm then going to turn off my machine. I'm going to pull my blanket away from the patient just so I can get their abdomen right over here. Okay. I'm going to place some protective padding down just in case we have any messes. I'm going to put my stethoscope in. Okay. I have my stethoscope. I'm going to put my stethoscope here. My tube is clamped. I'm going to disconnect it. Okay. I'm going to get my syringe, and I'm going to instill 10 to 20 milliliters of air.
I think so. So she came from.
All right. I have my ear, and when I do this, I'm going to be to the left of the xiphoid process. Okay. When I put this air in, I'm going to listen for a whooshing noise. This means that when I hear this whooshing noise, it means that the tube is in its proper place. If I didn't hear this whooshing noise, I would have to call the physician and get an order for an x-ray to find out where the tube is and put it back, and so that we could put it back in the proper place. But now that I've heard that whooshing noise, and I know the tube is in the right place, I can take off my stethoscope. I'm going to put that right there. I'm going to unclamp my tube. I'm going to take out some stomach fluid. Okay. I'm going to reclamp my tube. And with this stomach fluid that I took out, I'm going to record its odor, the color of it, any particles that might be in it. I'm going to put it into a container with my litmus paper, and I'm going to make sure it's at 4 or below. And now that we're at 4 below, I'm going to take 20 milliliters of saline. I have my 20 milliliters of saline. I'm going to put this back into the tube so that we can actually irrigate it. I'm going to unclamp my tube, making sure that this is vertical before I push it in, and I'm going to push that in slowly.
But that's where we got our syringes.
I don't want to force it in or anything. Alright. And now I'm going to take some remnants back, some contents back. Alright. I'm going to take 20 cc's back. I'm going to reclamp my tube, take my syringe off. I'm going to just kind of discard of the stomach fluid. Alright, and I'm just going to keep that in there. I'm going to reattach my tube. Alright. I'm going to unclamp the tube. I'm going to lay this right here. I'm going to get rid of my protective padding. Going to cover my patient back up, make sure that they're comfortable the way that they are. Okay. Going to put my bed rail back up. I'm going to bring them back down.
We're saying this is towards the iliac.
Alright, I'm going to turn my machine back on. I'm going to make sure my patient is comfortable. And I'm going to place the call light over here. Once I've done that, I'm going to clean off my equipment. Once my equipment is all clean, I'm going to take off my gloves. Alright, I'm going to dispose of those. Wash my hands, and then I'm going to go and record the contents of the stomach fluid, any odor, smell, or particles that were in it in my I&O report, and then I'll report back to my physician. And that is it.